Good morning all. My name is Dr. PJ Madam Rafi. Today we are going to discuss about estrogen, naturally available estrogens and their physiological effects. Okay. So first of all, types of estrogens. There will be four types of estrogen will be there. One is natural estrogen, synthetic steroidal estrogen, synthetic non-steroidal estrogen, conjugated estrogen. So if you see first in among these four, these natural estrogens are very important. In natural estrogens we have three types. Those are estradiol, estrone, estriol. Okay. So the names has to be remembered very well. There will be different estrogen produced in different conditions. Among these three, estradiol is most potent and it is predominant in reproductive age groups. It is mainly produced from the ovaries. Okay. Next one is estrone. It is main estrogen that is presented in postmenopausal women groups. So it is produced from the fat cells. Okay. Next natural estrogen is estriol. Estriol mainly presented in pregnancy group. It is produced from the liver. Okay. So in these four types, main thing is natural estrogen are very important. In these three natural estrogens, estradiol, estrone, estriol name should be remembered, and each in which condition it is predominant. Like estradiol is more predominant in reproductive age group, estrone is mostly important predominant in postmenopausal, estriol is mainly in pregnancy. Okay. Next is synthetic steroidal estrogen. Synthetic steroidal estrogen will have ethylene estradiol and tibolone. Synthetic non-steroidal estrogens we have diethyl stilbestrol, dinesterol. Next is conjugated estrogen. In conjugated estrogen, we will have mixture of sodium estrone sulfate and sodium equilin sulfate. Okay, it is a mixture. Okay, so these four types has to remember. In this main thing is natural estrogens. Okay, next. So estrogen mainly binds to 90% will be to the some binding protein. Those are sex hormone binding alpha to globulin and serum albumin. Okay. So it will be 90% binding to this binding globulin, that is sex hormone binding alpha to globulin and serum albumin. That means the only rest 10% will be rest will be free. It will be available in the body to show its therapeutic effect. Okay. So this normally estrogen will have two types of receptor. That is estrogen alpha and estrogen beta. Estrogen alpha will be located in uterus, vagina, breast, hypothalamus, pituitary and blood vessels. Where estrogen beta receptor will mainly predominantly located in prostate glands. Okay. So based on their receptor location, they will show different physiological effects. What are those? We will see in this one. Now following slide, that is main female reproductive system. What the physiological effect means? First thing is pubertal growth, development of fallopian tubes, uterus and vagina. Next is proliferation of ducts and stroma in mammary gland. Next is proliferation of uterine endometrium. These are all physiological effects of estrogen. Okay. Next, it will make watery secretions to facilitate sperm penetration. Okay. In the uterus, it will make watery secretion to make more penetration for sperm. Okay. So these are the physiological effects of female reproductive system. Okay. Next one is estrogen effect on CNS. That is, it will be beneficial in libido. Next, FSH, LH secretion hormones. Next, in CTZ center, chemotherapy triggering zone center, it will cause nausea and vomiting. Next, on blood, it will have decreased antithrombin 3 level. It is an anticoagulant. Next one is increased clotting factors. One is decreasing anticoagulant, increasing clotting factor means it will have an increasing chance of thromboembolism. Okay, that means estrogen will be increased chance of thromboembolism. Next one is increases HDL level, that is beneficial. Next, increase triglycerides and decrease LDL level also, that is also lipid profile. It will be benefit. That means estrogen will have good beneficial effect on lipid profile. Okay. Next one is, and when you are seeing in clotting factor, they have chance of developing thromboembolism. Okay. You should observe, like it will be having different effects on different systems. Okay. So based on those things, we will see following slides which drugs will be effective or not, all those things. Next is the metabolic effects of estrogen. It will cause sodium and water retention. Next is maintain bone mass. How they will maintain bone mass? By decreased bone resorption. Okay. By losing bone calcium, it will be decreasing. So it will be adding beneficial feature also. So these are the major physiological effects of estrogen on different systems. Okay. So there will be some others also there. Those are growth of hair as female pattern, then distribution of body fats in female counters, then pigmentation of nipple and genital organs. These are the other features of estrogen on female reproductive system. Okay. So next we will see the therapeutic uses of estrogen. Estrogen main therapeutic use will be used as a oral contraceptives. Mainly next is postmenopausal osteoporosis. Why? Because it will reduce bone resorption, thereby enhancing bone capacity. Okay. So postmenopausal osteoporosis will use. Next, urogenital atrophy, because urogenital atrophy it will enhance. There will be more available, more increasing activity of estrogen in the estrogen receptors, thereby atrophy will be decreased. Next one is dysfunctional uterine bleeding will be there. So in that condition also it will be beneficial. Next, dysmenorrhea and acne and hirsutism patients, then carcinoma of prostate patients. In all those patients we will use estrogen as supplement and therapeutic agent. Okay. Further, for the prolonged use, they will have some more side effects also. So there will be different. In males, it will cause gynecomastia, feminizations, decreased libido. In females, that is main important. Breast tenderness will be there, and withdrawal bleeding in OCP condition. For suddenly withdrawal, it will lead to cause withdrawal bleeding. Then endometrial hyperplasia, because of more estrogenic activity, endometrial hyperplasia will be there. Next, risk of breast cancers because of more estrogenic activity. Next is increased incidence of vaginal and cervical adrenal carcinoma in female offspring of mother who are using in estrogen supplements. Okay, so it is not developed in mothers; it will be developed in babies, indoor mothers who are using estrogen supplements. Okay, so when mother is pregnant, when the time she is using estrogen, so in that offsprings, in that babies, they will have chance of developing vaginal and cervical adenocarcinomas. Okay, that means it has a teratogenicity chance. Okay. So next one is main important adverse effect of this estrogen supplement in both patients will be gallstones and deep vein thrombosis. Okay, that's all. Thank you.